Welcome to this video. Today, we are exploring one of the most important yet often overlooked organs in the human body, the thyroid gland. This tiny, butterfly-shaped gland plays a massive role in keeping your body running smoothly. Let's dive into its anatomy and understand how it works. Introduction. The thyroid gland is located in the front of your neck, just below the Adam's apple, wrapped around the trachea. Although small, it produces hormones that control how your body uses energy. From your heartbeat to your digestion, and even your mood, the thyroid influences almost everything. Shape and location. Anatomically, the thyroid looks like a butterfly. It has two lobes, a right lobe and a left lobe, connected by a thin bridge of tissue called the isthmus. These lobes lie on either side of the trachea. In some people, there is an additional small part called the pyramidal lobe that extends upward from the isthmus. The thyroid is positioned very close to vital structures like the larynx, voice box, major blood vessels, and the parathyroid glands. Blood supply. The thyroid is one of the most richly supplied endocrine glands in the body. It receives blood from superior thyroid artery, inferior thyroid artery, and drains blood through superior, middle, and inferior thyroid veins. Because of this rich blood flow, surgeons must be extremely careful when operating on the thyroid to prevent bleeding and nerve injury. Microscopic structure. If we zoom in at microscopic level, the thyroid is made up of follicles, tiny spherical units filled with a jelly-like substance called colloid. These follicles store thyroxine, T4, and triiodothyronine, T3, the hormones that regulate your metabolism. Between the follicles, special parafollicular cells, C cells, produce calcitonin, a hormone that helps regulate calcium levels in the blood. Nerves around the thyroid. Two important nerves pass close to the thyroid. 1. Recurrent laryngeal nerve, controls the vocal cords. 2. Superior laryngeal nerve, helps with pitch and voice modulation. That's why throat discomfort or voice changes can occur in thyroid diseases or surgeries. Function of the thyroid. The thyroid gland controls metabolism, how fast or slow your body works. It influences heart rate, body temperature, weight, energy levels, digestion, hair and skin health, mood and concentration. The pituitary gland releases TSH, thyroid-stimulating hormone, which tells the thyroid how much hormone to produce. This system keeps your metabolism balanced. Associated structures. Just behind the thyroid are the parathyroid glands, for tiny glands that control calcium levels in your blood and bones. Although small, they are extremely important and must be preserved during thyroid surgery. The thyroid is also surrounded by layers of connective tissue and muscles such as sternohyoid, sternothyroid, omohyoid. These protect the gland and help in neck movement. Clinical importance. Understanding the anatomy of the thyroid helps us recognize diseases like goiter, enlargement of the thyroid, hyperthyroidism, overactive thyroid, hypothyroidism, underactive thyroid, thyroid nodules and cancers. Symptoms like swelling in the neck, changes in voice, heat or cold intolerance, weight change, or fatigue can be linked to thyroid function. Conclusion. The thyroid may be small, but it has a powerful influence over the entire body. From regulating energy to maintaining balance in your organs, it plays a vital role in your overall health. Understanding its anatomy helps us appreciate how delicate and complex this gland truly is. Thank you for watching. Stay tuned for more educational content.